everyone. We'll be going over the assessment comparison analysis today. We'll be comparing two different assessments, the Verbal Behavior Milestone Assessment and Placement Program, also known as the VB-MAP, versus the Assessment of Basic Language and Learning Skills Revised, also known as ABLS-R. Our presenters today is going to be Melissa Gibb, Alex Wilmarth, Alec Johnson, Allison Janes, and Anna Lavelle. First, we're going to go over the client summary. This is a client that we're going to be basing the assessments off of and picking the assessment that is most appropriate for him. Our client's name is Arthur. He's a 6-year-old boy recently diagnosed with autism spectrum disorder, ASD, and attention deficit hyperactivity disorder, ADHD. Arthur is an only child who lives at home with both parents. Due to the recent pandemic, Arthur has not been able to receive any formal assistance from ABA or the public school system. Parents would like to eventually enroll Arthur in school, but would like to address communication and social skills first. Some parental concerns are prompt dependency, no interest in social interactions, limited speech and verbal communication, and problem behaviors including aggression, self-injurious behavior, also known as SIB, property destruction, and tantrums. Some skills that our client currently has are simple matching skills, some fine and gross motor imitation skills, but will respond inconsistently when asked to demonstrate, sustained independent play skills with toys, and will make unintelligible sounds with eye contact to communicate.
First, we are going to talk about the VB-MAP assessment. The VB-MAP is an assessment tool that takes a topographical and functional approach to assessing a range of early developmental skills up to age 4 in a typical developing child. The assessment is used to evaluate performance on Skinner's verbal operants. The VB-MAP is divided into 5 different components. There's the milestones assessment, the barriers assessment, the transition assessment, task analysis and supporting skills section, curriculum placement, and IEP goals section. The milestones assessment of the VB-MAP. The VB-MAP milestones assessment is used to assess language, academic, social, and other related skills. The milestones assessment has 16 domains consisting between 5 and 15 milestones per domain. Milestone assessment is sequenced based on a typical development of the first 4 years of life and is divided into 3 different levels. The first level is 0 to 18 months, the second level is 18 to 30 months, and the third level is 30 to 48 months. For data collection, they can either score a 0, which is no criterion is met, 1/2, which is some of the criterion is met, or 1, where the criterion is fully met. Next, we're going to talk about the barriers assessment of the VB-MAP. The barriers assessment assesses 24 language and learning acquisition barriers. These are barriers to learning that make it more difficult for the child to acquire new skills. Each barrier is ranked on a 5-point Likert scale. The higher the score, the more barriers there are to learning, with a maximum of 96. For data collection, they can score anywhere between a 0 and a 4. A 0 meaning that this is not a barrier to their acquisition, and a 4 means that this is a heavy barrier to their acquisition skills.
The transition assessment of the VB-MAP provides a quantitative measure of overall skills to better assist with transitioning into a school setting. It assesses 3 categories for evaluating readiness to transition, which are language and social skills, learning patterns, and adaptive skills. Each category consists of 6 assessment areas that are either based on scores from specific areas on the milestone and or barriers assessment scores. Pros and cons of VB-MAP. The pros are is that it's developmentally based and allows for skill comparison between a child diagnosed with ASD and a typically developing child. It directs the order in which skills should be taught and how to build upon existing skills, allows for the assessment of problem behaviors and barriers to learning, and identifies the strengths and deficits in language as well as any missing gaps in language development. The cons of the VB-MAP is that it only assesses skills developed up to age 4 of a typically developing child, and it's only effective if conducted by professionals who are skilled in its administration.
Another common assessment that can be used is called the ABLS-R assessment. This assessment was developed by Dr. Partington, and it stands for the Assessment of Basic Language and Learning Skills Revised. This is an assessment tool that assesses various domains of basic learning and language skills and provides a recommended curriculum based on the results. The domains include language and communication, daily living, motor, social, academic skills, and more. The age range in which the ABLES-R can be used with is really any age, but it does typically focus on skill levels of children between the ages of 2 to 6. The ABLES-R evaluates 544 skills from 25 different skill areas. The task list items within each skill area are arranged from simpler to more complex tasks. For data collection, there is a range anywhere from 0 to a max score of 4, depending on the domain area. For example, some domain areas have a max score of 2, while others may have a max score of 4. A learner may score anywhere between a 0 to the max score, depending on what approximation of the skill they may already have. This allows the client to receive partial credit even if they are not able to complete the entire skill independently. For example, a client may score a 1, showing that they could occasionally perform a skill or maybe with prompts, versus a 4, which would show that they can perform the skill independently without any prompts. Every assessment tool comes with pros and cons. For the ABLES-R, some of the pros include that it addresses a variety of skills specifically intended to access a learner's readiness for a variety of settings. Another pro is that it is easy to translate into IEP objectives. The ABLES-R actually comes with a guide, and along with instructions on how to correctly score, it also is a guide on how to develop IEP goals and objectives that clearly define and target the learning needs of a student based on the results of the ABLES-R. Some of the cons of the ABLES-R include that it does take a long time to complete the assessment. This can be anywhere between 3 and 10 hours. The ABLES-R also does not address coping skills or problem behaviors and primarily focuses only on certain language learning communication skills instead of a barrier type assessment, which other tools might have, such as the VB map. And lastly, the ABLES-R does not compare skills with typically developing children.
So, as we have closely examined the pros and cons of both assessments, we have determined that although the ABLES may seem more appropriate due to Arthur's age, the VB map is better suited based on his overall profile and areas of deficit. For example, the VB map will assist in certain areas and prerequisite skills that need to be targeted, such as his social interactions, barriers, and maladaptive behaviors. So the next step for Arthur would be that once he is at an ABA clinic, testing using the VB map will be conducted within the first 2 weeks through observation and direct testing by a BCBA who is familiar with the assessment. The assessment will then determine what skills and/or barriers that need to be addressed, such as manding, social interactions, imitation, responding, etc. Once the assessment has been concluded, the next steps would then be to review those results, create goals, and determine what type of interventions would be most appropriate based on the milestone and barrier scores. Then, after 6 months, re-evaluation will be completed using the VB map to determine how Arthur is progressing. Once progress is shown in the reduction of barriers and improvements in certain skilled areas, such as social skills, then the ABLES-R may be reconsidered as another tool to be used to assess Arthur's readiness for school.